Low blood pressure, hypotension. Low blood pressure might seem desirable, and for some people, it causes no problems. However, for many people, abnormally low blood pressure, hypotension, can cause dizziness and fainting. In severe cases, low blood pressure can be life-threatening. A blood pressure reading lower than 90 mm of mercury, He, for the top number, systolic, or 60 mm He for the bottom number, diastolic, is generally considered low blood pressure. The causes of low blood pressure can range from dehydration to serious medical disorders. It's important to find out what's causing your low blood pressure so that it can be treated. Symptoms? For some people, low blood pressure signals an underlying problem, especially when it drops suddenly or is accompanied by signs and symptoms such as dizziness or lightheadedness, fainting, blurred or fading vision, nausea, fatigue, lack of concentration, shock. Extreme hypotension can result in this life-threatening condition. Signs and symptoms include confusion, especially in older people, cold, clammy, pale skin, rapid, shallow breathing, weak and rapid pulse. When to see a doctor? If you have signs or symptoms of shock, seek emergency medical help. If you have consistently low blood pressure readings but feel fine, your doctor will likely just monitor you during routine exams. Even occasional dizziness or lightheadedness may be a relatively minor problem, the result of mild dehydration from too much time in the sun or a hot tub, for example. Still, it's important to see your doctor if you have signs or symptoms of low blood pressure because they can point to more serious problems. It can be helpful to keep a record of your symptoms, when they occur and what you're doing at the time. Causes. Blood pressure is a measurement of the pressure in your arteries during the active and resting phases of each heartbeat. Systolic pressure. The top number in a blood pressure reading is the amount of pressure your heart produces when pumping blood through your arteries to the rest of your body. Diastolic pressure. The bottom number in a blood pressure reading refers to the amount of pressure in your arteries when your heart is at rest between beats. Current guidelines identify normal blood pressure as lower than 120/80 of a millimeter He. Blood pressure varies throughout the day, depending on body position, breathing rhythm, stress level, physical condition, medications you take, what you eat and drink, time of day. Blood pressure is usually lowest at night and rises sharply on waking. Blood pressure. How low can you go? What's considered low blood pressure for you may be normal for someone else. Most doctors consider blood pressure too low only if it causes symptoms. Some experts define low blood pressure as readings lower than 90 mm He systolic or 60 mm He diastolic. If either number is below that, your pressure is lower than normal. A sudden fall in blood pressure can be dangerous. A change of just 20 mm He, a drop from 110 systolic to 90 mm He systolic, for example, can cause dizziness and fainting when the brain fails to receive enough blood. And big drops, such as those caused by uncontrolled bleeding, severe infections or allergic reactions, can be life-threatening. Conditions that can cause low blood pressure. Medical conditions that can cause low blood pressure include pregnancy. Because the circulatory system expands rapidly during pregnancy, blood pressure is likely to drop. This is normal, and blood pressure usually returns to your pre-pregnancy level after you've given birth. Heart problems. Some heart conditions that can lead to low blood pressure include extremely low heart rate, bradycardia, heart valve problems, heart attack and heart failure. Endocrine problems. Parathyroid disease, adrenal insufficiency, Addison's disease, low blood sugar, hypoglycemia, and, in some cases, diabetes can trigger low blood pressure. Dehydration. When your body loses more water than it takes in, it can cause weakness, dizziness and fatigue. Fever, vomiting, severe diarrhea, overuse of diuretics and strenuous exercise can lead to dehydration. Blood loss. Losing a lot of blood, such as from a major injury or internal bleeding, reduces the amount of blood in your body, leading to a severe drop in blood pressure. Severe infection, septicemia. When an infection in the body enters the bloodstream, it can lead to a life-threatening drop in blood pressure called septic shock. Severe allergic reaction, anaphylaxis. Common triggers of this severe and potentially life-threatening reaction include foods, certain medications, insect venoms and latex. Anaphylaxis can cause breathing problems, hives, itching, a swollen throat and a dangerous drop in blood pressure. Lack of nutrients in your diet. A lack of the vitamin B12, folate and iron can keep your body from producing enough red blood cells, anemia, causing low blood pressure. Medications that can cause low blood pressure. Some medications can cause low blood pressure, including water pills, diuretics, such as furosemide, Lasix, and hydrochlorothiazide, Microzide, others. Alpha blockers, such as prazosin, Minipress. Beta blockers, such as atenolol, Tenormin, and propranolol, Inderal, Inopran XL, others. Drugs for Parkinson's disease, such as pramipexole, Mirapex, or those containing levodopa. Certain types of antidepressants, tricyclic antidepressants, including doxepin, Silanor, and imipramine, Tofranil. Drugs for erectile dysfunction, including sildenafil, Revatio, Viagra, or tadalafil, Adcirca, Aliq, Cialis, particularly when taken with the heart medication nitroglycerin, Nitrostat, others. Types of low blood pressure. Doctors often break down low blood pressure, hypotension, into categories, depending on the causes and other factors. Some types of low blood pressure include low blood pressure on standing up, orthostatic or postural, hypotension. This is a sudden drop in blood pressure when you stand up from a sitting position or after lying down. Gravity causes blood to pool in your legs when you stand. Ordinarily, your body compensates by increasing your heart rate and constricting blood vessels, thereby ensuring that enough blood returns to your brain. But in people with orthostatic hypotension, this compensating mechanism fails and blood pressure falls, leading to dizziness, lightheadedness, blurred vision and even fainting. Orthostatic hypotension can occur for various reasons, including dehydration, prolonged bed rest, pregnancy, diabetes, heart problems, burns, excessive heat, large varicose veins and certain neurological disorders. A number of medications also can cause orthostatic hypotension, particularly drugs used to treat high blood pressure, diuretics, beta blockers, calcium channel blockers and angiotensin converting enzyme, ACE, inhibitors, as well as antidepressants and drugs used to treat Parkinson's disease and erectile dysfunction. Orthostatic hypotension is especially common in older adults, but it also affects young, otherwise healthy people who stand up suddenly after sitting with their legs crossed for long periods or after squatting for a time. Low blood pressure after eating, postprandial hypotension. This drop in blood pressure occurs 1 to 2 hours after eating and affects mostly older adults. Blood flows to your digestive tract after you eat. Ordinarily, your body increases your heart rate and constricts certain blood vessels to help maintain normal blood pressure. But in some people these mechanisms fail, leading to dizziness, faintness and falls. Postprandial hypotension is more likely to affect people with high blood pressure or autonomic nervous system disorders such as Parkinson's disease. Eating small, low-carbohydrate meals, drinking more water, and avoiding alcohol might help reduce symptoms. Low blood pressure from faulty brain signals, neurally mediated hypotension. This disorder, which causes a blood pressure drop after standing for long periods, mostly affects young adults and children. It seems to occur because of a miscommunication between the heart and the brain. Low blood pressure due to nervous system damage, multiple system atrophy with orthostatic hypotension. Also called Scheidegger syndrome, this rare disorder has many Parkinson's disease-like symptoms. It causes progressive damage to the autonomic nervous system, which controls involuntary functions such as blood pressure, heart rate, breathing and digestion. It's associated with having very high blood pressure while lying down. Risk factors. Low blood pressure, hypotension, can occur in anyone, though certain types of low blood pressure are more common depending on your age or other factors. Age. Drops in blood pressure on standing or after eating occur primarily in adults older than 65. Neurally mediated hypotension primarily affects children and younger adults. Medications. People who take certain medications, for example, high blood pressure medications such as alpha blockers, have a greater risk of low blood pressure. Certain diseases, Parkinson's disease, diabetes and some heart conditions put you at a greater risk of developing low blood pressure. Complications. Even moderate forms of low blood pressure can cause dizziness, weakness, fainting, and a risk of injury from falls. And severely low blood pressure can deprive your body of enough oxygen to carry out its functions, leading to damage to your heart and brain. Please subscribe to my channel, Alexa McCulloch Video, and click that notification bell for more updates. Thank you.